Whenever you're ready.
Go for it.
All right. Knock, knock, knock. Good morning. My name is Nick. I'm going to be your nurse today.
Good morning.
I'm just going to be performing a simple bedside assessment, just assessing your systems. I'm going to wash my hands, and while I'm doing that, I'm also going to identify for any visitors in the room that the content might not be appropriate for. All right, so now that my hands are washed, I'm going to go ahead and check your ID band. Can you tell me your name and date of birth?
Nathan McWilliams, 12/18/02.
Perfect. So speech is clear and coherent. So now I'm going to assess your orientation. So, do you know where you are today?
Bright Point Community Hospital.
Perfect. And do you know why you're here today?
Just feeling a little achy and just
Achy?
kind of under the weather.
I'm sorry to hear that. And do you know what month it is?
November. We're coming up on Thanksgiving.
Thanksgiving, exactly. I'm very excited. You got any plans with the family?
Just gonna stay home with the family and enjoy.
That's awesome. All right. So patient is A&O times 4. So I'm going to go ahead and now move on to just tracing the tubes really fast. So if the patient had any tubes, like a nasal cannula, I would trace it from the machine back to his nose, and I would loop it around his ears, make sure that the flow rate is correct, and I would trace the IV. I would trace it from the machine to his arm, make sure it's intact, and I would make sure the flow rate is right. And then finally, if you had a catheter, I would make sure it's attached to his leg and his urethra, and the bag was attached to a non-movable part of the bed. I would check the color, sedimentation rate, and also the amount of urine, the output. So now I'll move on to allergies. Do you have any allergies?
Penicillin.
Penicillin, and what kind of reaction do you have to penicillin?
A little bit of a scratchy throat, trying to get a rash.
Okay, and how long ago did you have a reaction to penicillin?
I think the last time I took it was when I was 6, and since then I've just stayed away from it.
Okay, yeah, that's perfect. How about your pain? Do you have any pain?
I wouldn't really say pain, just kind of a general ache.
General ache? Okay.
Yeah, not really in pain.
All right. So if the patient had pain, I would use either WB faces or I would use old cards to get to the bottom of that pain. And I might also use nonverbal expressions to see how much pain he was in and how important of a priority that was. All right. So now I'm going to go ahead and look at your vital signs. So looks like the UAP came in earlier and took your vital signs. So your blood pressure was 120/80. That's very normal, so we like to see that. Is that normal for you?
Mm-hmm. That's
Okay,
normal for me.
perfect. Your heart rate was 80, which is also in the expected range. Is that normal for you?
Yep, that sounds about right for my resting heart rate.
Okay, and then they went ahead and got a fever of 101.5, and you do feel a little hot right now. That's
Okay.
definitely not normal, so we might have the doctor come in later, maybe prescribe you some antipyretic or anti-fever medication.
Okay.
And then your oxygen saturation was 96 on room air, which is exactly what we want to see, and your respirations rates were 16 and unlabored, which is perfect.
Okay.
And then I'm just going to go ahead and do a general inspection. So looking at the bed is in the lowest position. The side rails are up, and there is no spill on the floor, no hazards. And I think we can go ahead and move into the general inspection. So I'm going to start with the head and sensory. So not with my stethoscope. I'm just going to go ahead and ask a couple history questions. So do you have any problems with hearing or vision?
Nope.
And how about issues with swallowing?
Not that I'm aware of.
Okay, perfect. So I'm just going to go ahead and look at the back of your head. There's no patches missing from the head, behind the ears, on the neck. There's no wounds or lesions. And can you give me a smile, please? All right, face is symmetrical, relaxed expression. I'm just going to go ahead and look at the pupils. So you're just going to see a light in your pupils.
Mm-hmm.
All right. All right, so the pupils are equal and both reactive to light, the instrument. So now I'm going to just go ahead and look in the mouth. All right, so the oral mucosa is moist and pink, and the teeth are intact and all present. So we'll move on now to the chest. I'm going to go ahead and unbutton the gown, pull it down. So I'm just going to go ahead and ask a couple history questions. Do you have a history of coughing or shortness of breath?
No,
And do you smoke?
I do not.
You don't smoke. Okay, perfect. So now I'm just going to go ahead and inspect the chest. So the chest rise is equal and bilateral, and the breathing looks unlabored. Looking at your oral airway, just go ahead and open your mouth one more time. Okay, so the airway is unobstructed. He's speaking. The skin, I'm going to go ahead and perform a skin exam throughout the exam, but in a general inspection sense, the skin is pink dry according to ethnicity, and his mentation status is alert and coherent. So moving back to the chest rise and fall is symmetric, and your breathing is unlabored. So now I'm going to go ahead and auscultate your heart and lungs, starting with your lungs.
Are these your real teeth? No.
All right, so there is no advantageous sounds in the lungs, and I'm going to go ahead and listen to the heart, specifically the apical pulse.
Pupils are equal, round, and active to left.
Okay, so the apical pulse is normal. It was 80 like the UAP got earlier, so that lines up. So now I'm just going to go ahead and palpate really fast. So I'm just going to go ahead and palpate. Okay, and then I'm just going to go ahead and pinch under your clavicle. You're going to feel a slight pinch. All right, so with assessing turgor, there's no tenting. This patient is hydrated. So now I'm going to go ahead and put back up your gown, and I'm going to go ahead and pull up the bottom of your gown so I can assess your stomach. I'll put the bed down to a lower position so I can get a better view of his stomach. We're going to start with some history questions. So are you okay with voiding? When was your last void?
I think my last void was this morning before I came here.
This morning? Okay. And then how about your bowel movement? When was your last bowel movement?
Yesterday morning.
Any diarrhea, constipation?
Nope.
Okay. And then finally your diet. What's your diet look like from a day-to-day perspective?
Pretty normal, 3
Okay.
meals a day, sometimes a snack here or there.
Okay. Any fast food?
Every once in a blue moon.
Oh, that's perfect. That's what we like to hear. So upon inspection, it looks like there's no distension of the abdomen, no wounds, no dressings, no lesions. So now I'm going to go ahead and auscultate your bowel sounds, and I'm just going to be listening for your bowel sounds to make sure that they are active. So I'm going to start in the lower right quadrant, and then the upper right,
Well, I can ask that one.
and then the upper left,
No.
and then the bottom left, lower left quadrant. All right, so bowel sounds are active in all 4 quadrants, normal active. If the bowel sounds were not present, I would go ahead and auscultate for a full 5 minutes just to make sure that there are bowel sounds present. I'm now going to palpate.
Do you smoke at all? No.
Okay, so upon palpation, there's no masses, it's all no distension, and the skin is smooth and clear, pink, intact. So now I'm going to move on to the upper extremities after pulling up your gown. So upon inspection of the upper extremities, we're going to ask a history. So do you have a history of numbness, tingling, or weakness in the upper extremities?
Nope.
Nope. Okay, perfect. How about the hands or the fingers?
Nope.
Okay, perfect. So now I'm going to go ahead and inspect. So it looks like there's no edema, no pitting edema. There's no bruising, no wounds, no lacerations. So now I'm going to go ahead and palpate your pulse. Okay. So your pulse is +2 bilaterally equal. And now I'm just going to go ahead and assess your capillary refill.
Oh, I see. Okay, so next week they learn about.
Okay, so capillary refill is less than 3 seconds, equal bilaterally. Now we're just going to go ahead and do some range of motion exercises.
Okay.
So I'm going to go ahead and ask you to raise your hands, and I'm going to push on them. Perfect. And now lower them and push outward and inward. Perfect. And then can you go ahead and squeeze my hand? Perfect. So the patient is equal to opposing forces 5/5, and everything is good. So I will pull up the gown. His arm, upper extremities are perfect. I'm just going to go ahead and lower the blanket. All right, so with your lower extremities, do you have any history of numbness, tingling, or weakness?
Nope.
Okay, perfect. So upon inspection, like I did with the upper extremities, the skin is clear, dry, and it's clean, dry, and intact. So asked about history. So now I'm just going to go ahead and assess your capillary refill. I'm just going to squeeze on your toes. All right, so capillary refill is less than 3 seconds in the lower extremities. I'm going to go ahead and feel your pedal pulses. All right, so pedal pulses are +2 equal bilaterally. Now we're just going to go ahead and do some strength exercises. So one at a time, I'm going to ask you to raise your foot. Okay, and then raise the other foot. And then bring this foot up to your stomach. And then bring the other foot up to the stomach. Perfect. And then finally, can you just push on my hands? And then pull back on my hands. Okay, perfect. So the patient has no edema, no bruising, no wounds on the legs. Capillary refill is less than 3 seconds. Pulse is present. Skin is pink, dry, and intact. Now I will pull the gown back up. And I'm going to ask the patient to go ahead and flip over. He's not going to flip over in this example, but I would be inspecting his back for any bruising, any pressure ulcers, and also his buttocks for any pressure ulcers in the spots where the bony prominences are susceptible. I'm going to go ahead and as well as auscultate his posterior lungs to make sure there's no advantageous sounds in the posterior. And then finally, I would just check for any bruising, lesions, sores, anything like that, as well as feeling the skin for tenderness. And then I'll flip him back over. And I'm just gonna, now that we're done with the assessment, I'm gonna lower the bed to the normal position, raise any side rails up that I took down, and then we are all set. So do you have any questions?
When is the doctor gonna be in?
Right, so the doctor is going to be in within the hour. He's going to come and assess your fever, which we said was a little high. Maybe prescribe some antipyretic medication, which is an anti-fever medication. I'll be in an hour, and I'll be able to give you your medication that you have due. And lunch will be in about 30 minutes, so here's the menu. You can take a look at what you want. And yeah, the bed is lowered. There's no distress in the room. Visitors are allowed to come back in now that we've completed. Your assessment was completely normal. So as long as you have no other questions, I'm going to lower the bed, raise the side rails, perform hand hygiene, and I will be back within the hour with your medication.
Sounds good.
All right. You have a great day.
You too.